All right, let's take a deeper look now at where COVID-19, the vaccine rollout stands in the U.S. We're joined by Dr. George Benjamin, Executive Director of the American Public Health Association. Welcome back to the show.
Hi, Rochelle. Thanks for having me.
So get us up to speed. Where do things stand now with the state of the virus and these hospitalizations?
Well, the good news, I think, is that we're now seeing a real plunge in the number of cases we're having from this current Delta outbreak. So that's the good news. Now, we're going into the winter months, so we're cautiously optimistic. But, you know, we have over 70% of all adults that have been vaccinated. And if you go down to age 12, we've got almost 68% of our population fully vaccinated. So we're getting there. Not quite there yet, but we're quite getting there. And with the approval of the Pfizer vaccine for children 5 to 11, that gives us the opportunity to vaccinate 28 million more people.
So certainly progress, as you say there. And of course, experts agree that COVID will be with us for a while and that these waves of infections will likely ebb and flow. Are there concerns, as you mentioned, about any sort of new waves, especially as the winter season and flu season kicks off?
Well, we're certainly concerned about it. I mean, people are going to be going in more and we're going to be closer to one another. But I think if we do good pharmacological care, wash our hands, keep our distance, wear masks when appropriate, and more importantly, everyone get vaccinated, then that next wave, if it comes, it'll be much less than the wave we had before. And in fact, that's been the pattern. Very high peaks and then successfully lower waves over time.
And of course, a lot of parents now wondering whether or not to vaccinate their children. How is the effort to vaccinate children going so far in different states?
Yeah, it's actually going reasonably well in most states. Obviously, there's a lot more hesitancy in those states where they've been concerned about the vaccine and they're really getting a lot of misinformation. But, you know, I've been out and about and I'm seeing a lot of kids going out and getting their vaccines. It's still too early to get any really good numbers, but we think that most parents will eventually vaccinate their kids. Look, they just need to get more information. About a third of the parents have said no way are they going to get their kids vaccinated. But what we've seen over time with all of these vaccinations and with people that have been more hesitant, the more information they get from a trusted messenger, the more people they see that get vaccinated that are doing quite well. And quite tragically, the more people they see that are getting the disease, they're not vaccinated, the more people are willing to get vaccinated.
So then talk about some parents' concerns about COVID shots, especially since younger children, at least at the beginning, really did lag behind adult rates of contracting COVID. And then, of course, these concerns over these heart inflammation issues that some children have experienced.
Well, it is certainly true that children get a milder case and may not get as sick. But there have been over 8,000 hospitalizations. And we have many kids, up to 30% of these kids that have gotten in the hospital, have gone in the hospital without any preconditions. So that means they don't have any diabetes or any underlying conditions that make them more susceptible. And when the kid gets really sick, they get really sick. And we've had almost 800 kids who have died. So every child death is a tragedy, and it's totally preventable with the vaccine.
And as you mentioned, it really is a question of getting the right information. Talk about the medical community's response to these concerns.
We've been doing a lot of educating parents, particularly the pediatricians, the children's doctors. They've been spending a lot of time talking to their patients, getting them prepared prior to the availability of the vaccine. And they're now spending more time with parents in their offices, explaining them the pros and cons. And certainly if a parent is not quite ready yet, then letting them think about it and then come back later to get vaccinated. I think that's the way to do this.
And just quickly, obviously a lot of people looking ahead now to the under 5-year-old group. What's the likelihood that we'll see any movement on that? Where do things stand there?
There's certainly studies going on. The big issue, of course, is getting the dose right. The current dose is about a third of the adult dose, and the dose will probably be maybe even smaller for younger kids sometime mid next year.
All right, thank you as always. Dr. George C. Benjamin there, Executive Director at the American Public Health Association.